here live in Israel. I have Tali Berman to my right. She's the Director of Operations for PsyTech. And I also have Ben Gershon to my left, Director of Psychotrauma Department at the Israel Ministry of Health. And of course, we have Keren Tzarfaty, co-founder of the Hakomi Institute of Israel, MAPS trainer and Director of Israel projects and collaborations. And we'll start with you, Keren. Thank you so much.
Thank you for having me. So I'm happy to share with you a little bit about the activity in Israel and the road ahead. But in order to learn more about the future and the road ahead, I want to tell you about the past and the history that started in 2009, having Dr. Rick Dublin, the founder of MAPS, coming here and having this meaningful intention to bring psychedelic research and trials to Israel and to the Middle East and to the land and to the people here. And eventually met Professor Moshe Kotler from Ber Yaakov. He was at the time the head of Ber Yaakov. And together they kind of went and created a project of having phase 2 of the MDMA-assisted psychotherapy for PTSD in Israel, in Ber Yaakov. So we were one site out of 5 in Switzerland and in the state and in Canada. And we started, and I joined as a therapist at the time. And we saw 10 clients, 10 participants here in Israel. And eventually, after the phase 2 was over, we, with excitement, discovered that 68% of the participants that got MDMA versus the placebo were not considered to be suffering anymore from PTSD a year after the treatment was over. So that's pretty remarkable results, and the FDA thought so too, and declared our study as a breakthrough study. And that opened the door for us in Israel to other studies and to collaboration with the mental health department in the Ministry of Health, having Ben Gershon here, and together we created a collaborative project which offers the treatment, the MDMA-assisted psychotherapy treatment for 50 more people in 5 different hospitals in Israel, and Bella will tell you more about it. That was very exciting because we had 700 people in our waiting list asking to be part and to participate in the study, and we could not do that. We had 13 places. So we created this project that is going to be started, I think, in 2021. So that's a major project that is ahead of us. And in order to train our therapists, we offered, and we're now in the process of getting approval for another research that is going to work with our therapists, and they're going to have the opportunity to experience MDMA and MDMA psychotherapy, so they can come well-trained to compassion use, treating 50 people. What else? So other than that, we have a beautiful trial starting with Dr. Edna Foa and Dr. Nitza Nakash from Shiba, Tel HaShomer, and we're going to look at the integration of PE, prolonged exposure, which is a beautiful method for treating trauma, and MDMA-assisted psychotherapy. So I'm very excited and curious about this study and the results, working again with the treatment-resistant PTSD. Yeah. What else can I tell you? Let's see. We are now, in those days, also starting a new project, a new trial with Psilocybin, which is not a MAPS project, but it's supported by MAPS in Israel. And we're going to look at the effect and the safety of Psilocybin-based psychotherapy for depression, treatment-resistant depression. And when I say treatment resistance, I mean that those patients tried everything for depression, so therapy and medication, and nothing helps, so they come and they will try that too. And this research was done in different ways in the States and in Europe, and in this project in Israel, which is going to be with Dr. Eran Ariel in Ber Yaakov, we're going to look at the specific qualities of therapy and the characteristics of therapy, psychedelic therapy, in relationship to depression. What else? We're creating MAPS Israel those days, and we're just now creating a new non-profit, a local Israeli non-profit. Very, very excited about that, and hopeful that we can do more studies and more research in Israel and offer this very potential work with psychedelics, MDMA, psilocybin, more to people that are in great suffering. So that's what we do now, and we're going to have an opening night sometimes in the next few weeks, and to celebrate this big step for us. And when I'm looking to the future and thinking about what I want us to have here, so I think it's very important to continue and work with different diagnoses and disorders and people that are in really great suffering, and we can try and look and understand more about the potential of psychedelic work and psychedelic psychotherapy, so the integration of the psychotherapy with the substance, and see how can we help those different disorders. We're thinking about eating disorders, about addictions, about couples that one of them is suffering from PTSD, and more. Yeah, many different things. But we're also thinking about working with healthy people, and not only looking at diagnoses and pathologies, but also looking at just normal neurotic people that having just like everyday challenges, and see how psychedelic work can actually benefit them too. So things like just couple therapy, or just psychotherapy, like regular psychotherapy in context of psychedelics. And I think that's a very important, I would say, vision. So not only looking at psychedelics as a way to work with disorders and pathologies, but also starting to look at the potential of psychedelics for just healthy people, and not only about problems and difficulties and challenges, but also looking at us as human beings that can grow and manifest potential. So psychedelic work can offer us a way to look at consciousness. And really in psychology and psychiatry, we are not looking much from a clinical point of view about human consciousness. And there are so many great questions. What is it? What is the characteristics of human consciousness? And how can exploring our internal experience can help us and benefit us both as individuals, but also as maybe society. And just to add to that point, because it feels as if the field is very much focusing on the disorders and diagnosis, and I think that's a valid and maybe future direction to go. Yeah.
It's amazing. It's amazing work that you're doing, and there were a few things I wanted to sign up for. I think you said healthy neurotic, so I'll take one of those. I'll take a marriage couple, and also there is some anxiety. So yeah, definitely. I wanted to ask you just very briefly about the screening process. You have to make this very difficult choice, having a limited amount of people.
Yeah.
What's the process? Is it fill in a survey? Is there something very
Yeah, it's a whole process. There is a lot of questionnaires and an interview, and we both have a physical screening, so people need to be in a specific kind of health, and some problems, physical problems, won't go well with MDMA or psilocybin, and also emotional and psychological screening to see that it's a good fit and they can actually benefit from the trial, from the psychotherapy.
Is there hope that there'll be another trial soon after? I mean, it's a bit sad to say no to all those other people that want.
Right, so that's why we have the compassion-based project, and hopefully it will get medicalized and legalized soon, and then we can offer it to whoever is in need around that. Yeah.
Amazing. I wish you luck with it.
Thank you.
Which I think now leads us over to Bella Ben Gershon, who can continue answering questions about the direction we're going. Thanks, Bella.
Okay. I'm really glad to be here, and actually it's quite a strange feeling because, a few years ago, I couldn't even imagine to come here as a representative of Ministry of Health governmental organization and to talk about psychedelics. It's really a psychedelic experience for me right now. And I must tell you, historically, a mental health community in Israel is very, psychoanalytically oriented. I was psychoanalytically raised, and as a community, usually we use psychodynamic approach and psychoanalytic approach. And it was great, and we looked, kind of strange on the people who did not study these conventional approaches. And then I started to work with post-traumatic patients. And after many years that I worked in a public mental health clinic, I came to a Ministry of Health and started to became a director of post-traumatic unit for the citizens who suffered from PTSD because of the road accidents and because of the war and because of the exposure to terrorism and because of the sexual assaults. So many kinds of PTSD, and I found that psychodynamic approach and psychoanalytic approach were not so efficient with these patients. So we had, I called my lecture like evolution or revolution. It's both, because we started with psychodynamic and we finished with psychedelics today. And in the middle, we had a PE, and it was efficient with chronic patients, and we had SC, somatic experiences, and we brought also EMDR. And at the end, we had many others. But still, for some patients who really suffered and nothing helped, they were treatment-resistant patients, we could not help them. And then Keren happened. Keren happened, and they brought us to this great movie that I really recommend to each one to see, and it was called Trip of Compassion. And we saw the patients who participated in the research in our psychiatric hospital, and they were actually cured. Not just got better, they cured. So I looked at this and I was like, oh my God, this is really like breaking through. And it must be really revolution in psychiatry. And on the other hand, it was, oh my God, you know, psychedelics in our hospitals, drugs, we are doing drugs. And it was like, no, no, no way. So the next step was to bring this topic to the General Director of Ministry of Health. And then they invited me, Keren and MAPS invited me to have my own experience and to go through the training and then to experience the MDMA. And you know, I'm really, really square person, very square person. So this was
more.
this was a really. I have also. I think it was a challenge for my caregivers. You know, they were like, "Okay, this person, you never took drugs, never." I said, "No." Oh, this is the first time in our life we see somebody who never tried drugs. But then when I experienced it, it was really. Then I really decided that I will push the thing, you know, to the ministry, and we will try to legalize the treatment because it's not taking drugs. We all know this. This is a psychotherapy that is assisted by MDMA, and what I saw, it was the first thing that it was effective. Second, that it was time-consuming, because I think this 8 hours of trip were equal to 8 years of psychoanalysis, something like that. And also it was safe, you know. You don't get addicted. It's not like a marijuana that you take all the time, day by day. You take it, the treatment course of 3 months, and you're finished. And so we made a big, big step, and we decided not just to finish the research with collaboration with MAPS. We also decided to make one more step and have a compassion-based treatment for those who can't wait. You know, it takes time. It takes time to finish all the phases, first phase, second phase, third phase, and we will finish, and I'm sure it will be successful. But what about those people who can't wait? So it's only 50 people, and Keren, she mentions that there are 700 enrolled, okay? But this is a beginning, okay? This is a beginning, and when we get good results, we will start giving more patients will get this treatment. And I really hope that our vision is that it will be open access for many, many neurotic normal people. And for autism probably, and we know that we have research in this field too, and other people who suffer too, not just post-traumatic stress disorder. Keren is running now Psilocybin, and it's really great for chronic depression. And so we had a lot ahead, and expecting that the Ministry of Health will be maybe the first ministry in the world who will develop open access, controlled, safe, very safe, but for public, you know. This is it.
Can I ask a question?
Tali.
Go ahead.
Could you just define what you mean by open access? What does that actually mean?
Well, right now, open access is a compassion-based treatment. The next step, if everything goes fine, if the patients get treatment and they really get better or get cured, if the third phase of research will be finished with the results that we are expecting to, then we will bring it to the committee in the Ministry of Health, who will check it again with us, all the results, and decide in which cases we can give this treatment in mental health clinics with the mental health professionals. We should remember that it's a team project. We have a psychiatrist and a doctor who has to examine the patient to see that it's no contraindication for giving the MDMA, and not everyone can have it. And then we have checkups during the treatment with the doctor. We take blood pressure and the temperature, and we have to be really, really careful. But I hope that at the end, open access means that we can treat the patients in mental health clinics outside the psychiatric hospitals.
Right now, the project means that we're offering the treatment to 50 people even before it's actually legal. So it's compassion-based and not in a trial, it's not a research, and it's not yet legal, it's in between. And for us, it's also a way to prepare the clinics in the 5 hospitals and to train the therapists. So when it is legal, we can just start.
I forgot to tell that we already trained with a lot of help and with Keren and MAPS, 30 psychotherapists here in Israel. So when we start now compassion-based treatment, we already have psychotherapists who are ready to start.
Can I ask one other question? I have time for one more question. Okay. What kind of timeline do you imagine? So you're thinking about open access, a time where you'll be able to look at different people suffering from different kinds of issues and offering it outside of the hospital setting. Do you have a time in mind where you think that's practical, where that can be, or what you aspire to?
It depends on Corona first, you know.
Right.
It's really difficult to say. I would like to see then in 1 year we will be with the results from a compassion-based treatment, and if everything is okay, who knows, maybe in 2 years, if it's no Corona and no other bumps on the road, we can go there. But I want to be, you know, optimistic but careful.
We have to finish phase 3, which we do in many sites, 15 sites in Canada and the US, and 2 in Israel, in Shiba, Tel HaShomer, and Be'er Yaakov. And when we get the results of phase 3, which we're just in the middle of the trial right now, then we have to go through the FDA and the legalization of it, and then in Israel. So I think 2024, probably something like that. And the open access before, of course, like
Open access before.
Yeah.
And has COVID halted that process? Has that gotten in the way of things moving?
COVID has gone in a way for everything, you know. Yes, of course. But still, we are moving forward because, you know, we continue our training for our mental health professionals, and you know, we use Zoom as everyone else, and Keren continue.
Yeah, we finished the first part of phase 3, and it was not affected so much from the COVID. We pretty much was done with it almost at the end. And we're now just opened last week the first psychedelic psychotherapy training program in Israel, which is going to be ended in another week of MAPS training. And it's all online for now. So we're trying, being creative and not letting the corona stop us, but also being careful. Yeah.
Well, you know, we're grateful for all of the work that you guys are doing, because I know that's a large mountain to climb, getting through bureaucracy and making change, and hopefully it'll go forward with strength, especially now. We need it more than ever, really, don't we?
All right.
Yeah.
Now we're going to go over to Tali Berman, the Director of Operations for PsyTech, and she's going to be discussing the power of unraveling misconceptions through education, which is really where it starts. Thanks, Tali.
Thank you. Well, first of all, it's just such an honor to be on a panel with you women. You're really the trailblazers, and to be able to educate, we have what to educate because of all the work that you're doing, so just want to start by really thanking you. But yeah, so the power of unraveling misconceptions through education is what I want to focus on today. There's an incredible power to unraveling misconceptions, and when I say that, I mean to really reveal the ultimate truth of a matter. And this is true in psychedelics, and this is true in every field. And it's actually interesting that you brought up, Bella, just a moment ago about autism, because before I was the Director of Operations and Education at PsyTech, I was an autism specialist for over 20 years. And I want to demonstrate the power of unraveling misconceptions in that sector and how I saw that directly impact people's lives, and then how that's true in the psychedelic sector as well. So one of the primary misconceptions I came across in the field of autism was this: a person's verbal communication skills directly reflected his or her comprehension skills. Meaning, a person at any age, if they had limited verbal skills, if they can speak in single words or even syllables, then the assumption was they had very limited ability to understand. And so this affected the way people interacted with, communicated with, and educated people with autism, which was insulting at best and really damaging at worst. Thank God, in the time that I was working with people with autism, myself and my colleagues really were able to see creative and alternative solutions to communication. And people began to communicate through typing or through pointing, and were able to express, I want to learn so much more than you're teaching me. I know to identify my body parts. I know how to match colors. I know the days of the week. I have a thirst to learn so much more. And that was groundbreaking. And then people can really teach people with autism in a different way. And we were able to learn cell division and puberty and philosophy and science. And so it completely impacted their lives. It impacted and changed the way we interacted with people with autism, the way we communicated with people. So I was really able to see how this misconception completely informed everything we did. And it became my life's mission to really shout that from the rooftops, that a person's verbal communication skills means absolutely nothing about their comprehension. Now, as the Director of Operations at PsyTech, I find myself again in a position of coming up against a real big misconception. And so I want to talk about what those misconceptions are here. So the misconception in the psychedelic sector, well, let's first discuss that psychedelics are Schedule I substances, which by very definition means that number one, they have no medical use, and number two, have a high potential for abuse with potentially severe psychological or physical dependence. However, as you all know, none of this is true. And the very unraveling of these misconceptions will change the way people perceive and access a new paradigm in mental health care. So before I share some of the data, sort of what I call the greatest hits of the data that just makes it so compelling, I want to share some statistics about why this is not only important, but it's urgent. Mental health disorders are one of the leading causes of disability in the world. 1 in 4 people will experience at least one mental health disorder in their lifetime. Globally, over 300 million people suffer from major depressive disorders, and 1/3 are resistant to treatment. About 35 million people struggle with substance use disorders. 6 to 9% of the population suffers from PTSD. And this is a fact that I still can't get over. In the US military, for example, more soldiers from the Iraq and Afghanistan wars have died from suicide than in combat. And this is before the global pandemic that we're currently facing. The rates of depression have tripled in the US since the start of the pandemic, which is one of the reasons I asked about how COVID's affected your study and your work, because in certain ways it's made it even more urgent. It's brought it to a head in a different way. But the truth is, psychedelic-assisted therapy has the potential, as you all know, to revolutionize mental health care. And the time for that shift is now. So I wanted to use this time to begin unraveling those misconceptions and share how the first misconception is that psychedelics have no medical use. So Keren, you're very familiar with these statistics. This is results of phase 2 trials of PTSD and MDMA. This is a graph that shows 82% of people who used MDMA-assisted psychotherapy showed significant improvements, and 56% no longer meeting diagnostic criteria, which is something that you had talked about in just a moment previously. To talk about addiction for a moment, this is a trial done by a team at New York University who did a trial with psilocybin and drinking. Heavy drinking days went from 35%, that's the red line at the bottom, down to 12%. And the blue line is drinking days at all. Days that participants drank at all went from 40 to 15%. It's a dramatic shift in drinking. Another addiction some data I want to share with you is from Matt Johnson and Albert Garcia-Ramu and their team at Johns Hopkins, who we're very honored to have presenting in the summit this year, did a study on the effects of psilocybin and smoking cessation. In a 6-month follow-up, 80% of the participants had quit. In a more recent follow-up, 60% remained smoke-free after 2.5 years. And compared to the 10 to 20% abstinence rate for typical nicotine replacement options, this is absolutely groundbreaking. This is results from a study done with Robin Carhart-Harris and Professor David Nutt. Again, 2 people we are very honored to have participate in our summit this year, who did a study on treatment-resistant depression and psilocybin. All participants showed some immediate improvements, and 8 of the 12, so 67%, achieved complete remission after 1 week. And after 3 months, 5 still were in remission. And this is actually a graph that Professor Nutt shared earlier in his presentation. So the first misconception I wanted to talk about today is the fact that psychedelics have no medical use. Right? All this data is really showing that not to be true. But then the addictive and dependent and abuse component is just as much a misconception. So this is a graph that Professor Nutt and his team had created on the safety profile of psychedelics. And as you see on the left-hand side, LSD, mushrooms are on the lowest scale of harm. The blue is harm to users, and the red is harm to others, which I think is an interesting way to rate substances anyway. You see all the way on the left, alcohol is the highest. They obviously have cocaine there. Tobacco is on the left-hand side too. Psychedelic substances are amongst the most safe substances compared to others. And the last one I wanted to show here is about the addictive profile of psychedelics. So again, I think what's so interesting about this one, you have caffeine right there in the middle. I mean, how many of us drink coffee or drink Coke Zero, right? You get caffeine one way or another.
It's me.
And mescaline, LSD, psilocybin all have much lower addictive profiles than things like caffeine, certainly less than alcohol, cocaine, and tobacco. So these are 2 of the big misconceptions, that there's no medical use and that they cause abuse and have a high level for dependency. So I was honored to witness in the autism field that sharing the truth of the matter and unraveling misconceptions had a direct and lasting impact on people's lives, and still do. And here too, as this truth is being pushed to the forefront, people's lives are being impacted, and those suffering from very, very difficult to treat mental health conditions are experiencing peace for the first time in many years. And I know that you both have had firsthand experience of what that looks like. Our mission at PsyTech is to reverse the stigma through education, which is why we have our summits, which is why we have our webinars. And I want to use this opportunity to announce that we are launching for the first time our online course, The Fundamentals of Psychedelic Medicine. This is an online course for anyone who wants to investigate the science behind psychedelic medicine. Healthcare professionals, patients, advocates, we're really excited. We put a lot of time into this course, sharing the compelling data. The graphs that I shared in the data are just the greatest hits, best of that were taken right from our course. To learn more about our course, you can go to the expo at our PsyTech booth and go to the offers, and you'll see there if you enter in a code, PsyTech 2020, to get 20% off the course. We're really excited to contribute this course to the education in the psychedelic community. So I just want to end by saying thank you to all the researchers and the scientists and the institutions that support them, both in the summit and those that are cited in our course, to really being the trailblazers. And we just, as you said, may just go from strength to strength so that we can just continue to grow this field and give people access to those who need it the most.
Thanks, Tali. Thank you so much. I have to say, you know, the one good thing that's come out of COVID is people's ability to change. Everyone has turned their lives up, pivoted, changed, adapted. If we can do that under these circumstances, we can change this through education, through research, through fighting the health ministry in whatever angles. So I thank you, Tali, Keren, Bella, for being here today. It means a lot to us. Thank you.
Thank you.